Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing clinical application of Dravya. In Guruchi and Yashtimadu, we analyze the Dravya and its karma on the basis of Rasapanchak, and we have started with the Vasa to move a step forward that how the drug should be administered according to the disease to get fast results. So we have discussed the Vatakrut karma, Swarya karma, and now we will move forward to the Kapha Pittasta Nashana. The Kapha Nashak, Pitta Nashak and Astra Nashak means Rakta Pitta Shama. Titta Kashaya, Katu, Sheet, Lagu Ruksha, except Shita Virya, everything is Rasa Kapha Nashak. So it is a very good medicines in the Kaphaja Valley, and to balance this Shita Virya, which is Kapha Vardha, what will be the choice? The first choice, it will be Anupana. So it may be a Koshna Jala, it may be a Madhu, which is again Madhu is Kaphagna, or if you want to add Ushna Virya in the place of Shita Virya, keeping all the Rasa Panchak as it is, keeping other Rasa Guna Vipak as it is, the another good choice in the Kaphaja Valley is Vasa Ghana. So you can use Vasa either Swaras in the form of Arkwat for that Ushna Virya, or Vasa Ghana, Anupan Koshna Jala, or with Madhu. In the case of Pittaja Valley, Pitta Kashaya, Shita, Lagu Ruksha, everything is Pitta Shama. So you can have plain water or cold water also will do as Anupan. You can use Vasa Panak for Pittaja Valley. You can use Vasa Gruta as Gruta is Pitta Shama, or Anupan Gruta or Vasa Siddha Gruta. Then you can use Dugdha like Dravya also to have Pitta Shamana. See, Tikta Ras is a very dominant ras of Vasa. So Vasa is useful in both Pittaja Valley. Pittaja Valley are of two types, of Sam Pitta and Niram Pitta. So in Niram Pitta you can use all these Anupan. To have Sama Pitta, you can have to think of the Samata, and in that case you can use Koshna Jala as a Anupan for Pitta Shaman as well as Amapachan by Vasa. The next is very important in practice, it is Astra Nashana. Astra means Rakta. So this word is, by this word it is expected that it is useful in Rakta Pitta. Vasa is the best medicine for especially in the Urdhva Rakta Pitta. Now in short, Rakta Pitta, there is Pitta Rakta Sahacharya in nature, Dushti of both these elements, and because of this there is a bleeding through the various orifices, so Urdhvaga, Adhoga, Tiryaga. Now Vasa, as I said, is useful in all types of Pittaja Vyadhi by Tittaras, Shitavirya, Laguruksha Guna. Shitavirya definition itself is Sambhani Himaha, so it will stop the bleeding from the body, and also it will reduce the Pitta, which is the main dosh in the Rakta Pitta. Now the question is, logically we have proved this, that in Rakta Pitta all Rasa Panchaka are useful. How will you administer Vasa to have fast action? The first answer, Vasa Swaras, because we have learned in Vaishesha Kalpana that Swaras is, as it is fresh one, it has got highest potency, so it will be useful to stop the bleeding as a quick effect. But in our OPD level, it is really hardly we have seen that we can use a fresh Swaras and ask the person to take it. So we have to use the Kalpana. So next Kalpana which is useful is of course Vasa Churna. What will be the Anupan? as it is a pitta rattaja vyadi, ratta and pitta both are dosha dushya, so vasa ghruta is the best anupan, siddha ghruta or ghruta anupan to pitta shaman and also ratta stambhan. So in case of ratta pitta, the choice which I will recommend, that vasa with ghruta or sankalp or the kalpana of the vasa, is vasa siddha ghruta. Hence, as disease changes, the anupan and kalpana also changes. Always remember. Now, if the patient is of ratta pitta, you are giving vasa ghruta as a kalpana. At what time you will give it? And what is the dose? How you will give it? As I said, it is specifically useful in urdhva ratta pitta, rattam jivam iti sthiti. So if you want to use vasa for ratta pitta, always give this ghruta muhur muhur. Give it continuously until bleeding stops, because it is a urdhva ratta pitta where vasa is mainly indicated. Of course, it is useful other ratta pitta also with other medicines, but specific use in if you are using for urdhva ratta pitta, to stop that gati of ratta which is getting outward, you have to use this vasa ghruta muhur muhur. So ask the patient to take it frequently. Now 5 minutes, after 10 minutes, 15 minutes, you decide. But constant muhur muhur is the outer seven kal, which will reduce the gati of the dosha, as well as it will be useful for the ratta stambhan karma. So what I mean to say, only kalpana or proper kalpana is one step, but at what timing you are giving is also important to have good results. So in case of ratta pitta, the vasa ghruta will be the better choice of vasa. Next line is tikta stuvaka, means tikta kashayas, rudyo. Now in case of rudya chikitsa, in rudro, you will find the sutra that they have indicated vamana in rudro. Vasa, as I said, tikta is very dominant, and by tikta rasa it is useful for the vamana chikitsa in the hridaya rog, depending on the patient's condition. The next condition, as far as rudra is concerned, you will find it is tiktaras, ruksha guna, shoshya rukshaha. So all these are kapha nashan. So hence it is useful in kaphaja rudro, where for example it is useful in cardiomegaly, where there is rukshetilya, the muscles of the heart gets, myocardium gets elongated, and so there is this cardiomegaly, pumping gets affected because there is no tone of the muscles, etc. So in that case, you can use vasa to have the constriction action, and by that the muscles which are now this is normal muscle, say for example in Rushaitilya it has been loosened, and that's why all this anatomical structure is now hampered, and that's why the strength of the muscle is reduced and the proper pumping is not happening. So in Rushaitilya, by using vasa, this vruddhi or shaitilya is reduced and the muscle fibers get compact, so the strength is achieved. So in that case, you can use for that purpose. How you will use it? Again, vasa ghana, vasa churna. Now if you want a further good combination of or a kalpana of vasa, you can use it vasa arishta also to have fast action, because it is also because of arishta avyavayika siguna achieved. As I said, kalpana is very important. in Ratta Pitta, I just forgot to say, Vasa Grutha is very important, and don't use Vasa Avleha. We are giving Vasa Grutha Muhur Muhur. Avleha is also meant for that purpose because you lead that Kalpana, but Vasa Avleha have got Prakshat Dravya which are of Ushna Tishna Gunatma. So they are not indicated in Ratta Pitta. So though Vasavaleha you can give more, it is not indicated in Ratta Pitta, but Vasagruta is more proper Kalpana in that disease. I just forgot in Ratta Pitta, so I mentioned it afterwards. So in Rudro, in for one purpose, for Utshetilya, you can use Vasa Adishta, which is available in the market. Other disease will, and the Vasa in that this is which Kalpana is indicated, we'll discuss in the next lecture. Thank you very much.